Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release, ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty. All right, Michael, tell me what's going on with your feet. What happened?
I've been diagnosed with plantar fasciitis, and over about a 20-year period, they've somewhat gotten better and then gotten worse again, and now they're really bad, and nothing seems to help.
So, for the last 20 years, what kind of treatment did you have?
I've had custom-made orthotics.
Custom orthotic.
I've been given stretches, splints,
And
and
splints, okay.
some laser therapy.
So you had laser therapy. Did you had any shots, any surgeries, anything?
I've had cortisone injections, and my left foot I had the plantar or fasciitis release.
You had the release surgery?
Yeah.
On which one? Because you said you
My
have.
left.
So the left, and how'd that feel?
It's a little better, but it's still not great.
Okay. So how much pain do you experience there from 0 to 10?
It's probably 4 to 5.
4 to
daily
5.
On a daily basis.
On a daily basis. And you feel pain when you wake up in the morning? When do you feel the pain?
As soon as I get out of bed, and
First few steps?
well, as soon as I wake up, my feet's kind of sore, achy, and
Okay.
then the first few steps, it's real sore, tender. Then the longer I'm on them all day, more I walk, more I stand,
You feel
the
more
worse it
symptoms.
gets.
Okay. What kind of pain? Sharp, dull, aching? How would you describe the pain?
At times it's aching pain and
Okay.
dull pain. Sometimes it's more of a sharp pain.
Okay. Can you show me where do you feel the pain? Let's see.
Right here.
In both feet.
Yes.
Yes. Okay. All right. So make sure. Let's have you actually walk and tell me how much pain when you walk. From 0 to 10. How much pain with that?
It's about a 6 today, probably.
6 for both.
Yes.
Okay. So I will have you lie in your stomach, head over there. So you had cortisone, you had laser, you had exercises, PT.
Yes.
Okay. And you had plantar fasciitis release surgery. Yeah. Anything else?
That's it.
Okay. Make sure what I'm doing here is not painful. Okay. So this is the spot. Yeah.
Yes.
Okay. Is there one side worse than the other, or both are the same?
My right foot's worse.
Your right foot is worse. Okay. How does that feel?
It's a little sore, but it ain't bad.
Make sure what I'm doing is not painful. Okay.
Okay.
You feel this band here?
Yes.
You have a band here. How's that?
That's a little sore.
Make sure what I'm doing is not really causing pain, okay?
Okay.
Because there's fine line between release and causing actually trauma. So we don't want to cause trauma to the healthy tissue, okay?
Yep.
Yeah, your feet very dry. Okay. Are you diabetic?
No.
Okay. So I'll focus on this for now and see how you're doing, okay? The left, is the left worse or just both the same?
The right one's worse.
Okay, let me focus on this. Okay, and you said the left, that's the one you had the release, is that correct?
It is.
Okay. How's that?
That's a little bit sore.
Is that cause more soreness when what I'm doing? Or it's okay?
Well, just the pressure.
As long as you don't feel pain, if you feel pressure, that's normal. That's part of the treatment. Pressure is okay, as long as no pain. Well, this knot here, got a scar tissue here, by the way. Feel that?
Yes.
Okay, it's a big knot here. Any soreness here? That's okay here.
That's fine.
Okay. So you have a little inflammation here. Okay, you're gonna feel cold, okay?
Okay.
You feel that scar tissue here, all those bumps?
Yes.
That's the scar tissue. You have a lot of scar tissue. That's nice. You get little cut here. What's going on? You get a scratch everywhere.
I was just outside working all weekend
Mhm.
around the house.
Yeah. too much?
Oh, that's good.
What's happening? Too much?
No, it's just a,
You're jumping.
yeah, it's just a flinch.
Okay, what about now? How's that?
That's fine.
But you feel that nod here. It's a lot of scar tissue here in that area. So. How's that?
It's fine.
Do you hear that grinding?
Yeah.
That's a scar tissue. Too much?
Yeah, a little too much.
Sorry. You know, it's too much. Oops. Oh wow. This side is not as sensitive as the other side, is that correct?
Well, it doesn't bother me near as bad, but
Where do you feel it?
well, it's about a 4 on my right foot. I still feel it right here.
In the right foot. What about the left?
Left foot's, it's actually pretty good.
So the left is fine. The right foot, you feel it for in that spot.
Yes.
Okay. Let's actually lie in the same position. Okay. Here?
Yeah, right in that,
Here?
well, on towards my toes, right in there.
Here?
There.
Is that the right spot?
Yes.
Okay. Okay, let me do a couple of things. Okay. Oh, sorry. There you go. So right in here, yeah?
Yes.
How does that feel under in here?
That's not bad.
Okay. All right, so Michael, we finished the last third treatment, third day on your plantar fasciitis. Can you give me like a little update? What happened?
Well, the left foot, it worked really well on it. The right foot has helped quite a bit, but it's
Quite a bit
just,
of inflammation.
but there's a lot of inflammation in it.
Mhm.
Just
So when you started, how much pain? Let's go over like symptoms you had before. How much from 0 to 10, and what was difficult for you to do, and then now a little bit update about that.
well, before we started, both feet were sore all the time. Real bad first thing in the morning.
From 0 to 10.
First thing in the morning is probably about 8.
8. Both of them, yeah.
Both of them.
Okay.
And then throughout the day, it just continually, gradually got worse and worse. And by the end of the day, it was every bit of 8 or 9.
Mm-hmm.
And it's a lot better now. My left foot's practically nothing, and my right foot's probably maybe a 3 at the worst.
Okay. So how many treatments you had so far?
3.
3 treatments. So today in the morning, actually, when you woke up, give me an update. How did you feel on the left and the right?
Well, this morning when I got up, the left, it practically didn't bother me none at all.
Okay.
And the right was very little, maybe a 1, 2.
Not bad. Not bad. Okay. So what's your feedback about ASTR treatment, just having a few treatments?
I would definitely, if anybody's having any problems, I would definitely consider trying it.
Yeah. Thank you. Thank you.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.